Good morning, afternoon, or evening to everyone who are joining us here, and I'm sending the best greetings to all of you from a very beautiful and sunny day from Tallinn, Estonia here. I'm extremely happy that all of you were able to join us today, or people can also join us a little bit later and watch our recordings. So we're going to start now with our 6th edition of our digital discussion, which is of course organized again by the e-Estonia Briefing Center. And this time we are going to focus on a very, very essential topic, which is of course e-health. We're talking about from digital health solutions to combating, of course, also Covid-19 crisis, which has called a lot of new solutions also to the market to solve the crisis here. So my name is Anette Numa, and I'm a digital transformation advisor, and I'm also going to be your moderator this entire event here today. But I'm also joined by 6 leading companies who have also developed different e-health solutions in Estonia, and they're named Nortal, Helmes, Viveo Health, Guardtime, Cybernetica and Certific, who are also going to present their solutions and talk about Estonians' health infrastructure that has helped the country to also cope with the COVID-19 crisis here. Today, we note that like almost all the prescriptions are issued online here, and every person who have visited the doctor in Estonia has also the medical platform, medical information fully based online. Our entire e-health system is based on blockchain to make sure that our integrity of health data is ensured in a way. And also 2.3 million queries are made in our health information system by doctors every single month. And I would like to remind you that Estonian population is only 1.3 million people. So the number is actually very, very, very big. But how all this has happened here, I would again have to refer to our wonderful companies. And you're going to hear a lot about this, how they implemented their systems and what they're currently doing, what are the biggest challenges and threats also to the market, and how they could also help the US market there. But before I'm going to introduce our very first speaker, I also have some housekeeping rules that I would like you to know. As we're again operating on our platform, which is WorksUp, then of course the same rules as every time, that you can see the entire schedule, you can see all the speakers, you can send them questions, you can see their backgrounds, and of course also as today we're again going to have 2 panel discussions too, so you can also submit your own questions and upvote the questions that you would definitely like my lovely colleague Florian Marcus later and also to ask from our panelists here. But now, I am more than honored to welcome our very first speaker, who is no other than the former president of Estonia, so Mr. Toomas Hendrik Ilves. The stage is yours.
Well, as Annette said, good morning, good afternoon, good evening. I've been dealing with creating e-Estonia for 27 years now, and we've been doing rather well in this field. But today the focus is on healthcare, and here I would like to say that we are facing in the 21st century opportunities and also challenges we have never had in healthcare before. When we see that healthcare costs have risen in the United States to about 19% of GDP per capita. Here in Europe, 10 to 12% of GDP. It's quite clear that this is a very enticing area for IT companies. And of course, many of them are getting involved in this area. But at the same time, we see a huge amount of distrust in these matters, and well, why not? Perfectly justified dis and mistrust in digital solutions to healthcare because of all of the various episodes that we see with increasing frequency, I might add, in which we see data leaked, we see personal data going places those data should not go. We see ransomware attacks where people cannot access their healthcare data. And all of this, of course, only serves to promote a kind of Luddite mentality when it comes to healthcare, because there is nothing more precious to people as far as their data are concerned than privacy and security. Now, Estonia's solution to these problems, but also to exactly the same kind of solutions about issues of privacy and safety and security, touch virtually all fields. And so we actually have a broad ecosystem that we have created here in the past 20 years, beginning in 2001, that is really based on 3 pillars, which I'll just briefly mention. First of all, everyone here has and needs to have a secure and unique personal digital identity, an identity that can access services using 2-factor authentication and end-to-end encryption. These are the sine qua non factors that you must take into account if you're going to do any kind of serious health care. It is not enough to have an email address and a password. You need 2-factor authentication, meaning something you have, a token, and some way of combining with that token to verify who you are. Secondly, you need a digital data exchange layer. That is something your data must be distributed. That is that you cannot steal it all, but rather, if worse comes to worse, and you do manage to break through, say, the secure digital identity, you can only get one person's data. I mean, that's pretty basic. Based on kind of the Exxon Valdez tanker model that you compartmentalize. I mean, something people learned after the Exxon Valdez massive leak of oil is that you need to put compartments in your oil tankers. So too with our data, and that compartment must go down to the individual. And so a distributed data exchange layer, which we use, we call it X-Road. You can look it up. Just type in, go to YouTube, write X-Road, longer version. It's short, it's only 3.5 minutes. But you can see how it works with the strong security that the second pillar of a distributed architecture gives you. And finally, the third point, which unfortunately in all of these discussions of digital health gets ignored, kind of, is the issue of data integrity, but especially when it comes to digital health. You know, integrity means that your data have not been changed. It's far more important than privacy. I mean, if someone publishes my blood type, I might be vexed and annoyed. If someone changes my blood type, it can kill me if I end up in the hospital and the record gives the wrong blood type. And we can go on and on about all the various things in your medical record that unless you have a proper system, can be altered. And this is why since 2008, all critical data, not only medical records, but also property records and social welfare payments and our laws and our court cases, are all on a private blockchain, which means that basically you cannot change data of someone without that person's approval and authorization. These 3 components really underlie a secure medical system. Now, I realize, especially when it comes to the United States, is going to be where people are reluctant to actually have a nationally provided digital identity. There are workarounds, be they using driver's licenses with a chip or with a commonly accepted digital identity that HMOs use. But unless you really get a secure identity, digitization will go nowhere in countries that will not accept a a secure digital identity. That's the sort of basis for everything. And from there on in, what kind of architecture you choose, that's perhaps the next decision. And then, of course, we have, my suggestion is to always put all those data on blockchain. That's the basis of why our system has functioned without breaking down for the past 20 years and securely without any break-ins. Given the importance of digitization of healthcare, as we have seen with the COVID pandemic, where Estonians actually didn't have to do much at all, because they can do virtually everything, including renew their passports or their driver's license or everything digitally. We see that digitization actually is a much broader issue than merely healthcare, but at the same time, it's quite clear that having a digitized healthcare system has done much to save lives here, not only, of course, when it comes to COVID, but overall, in terms of both convenience and security and safety. And if you think that digitization is difficult, just think about what happens if someone, when it comes to privacy, what happens if someone actually, as was the case with Michael Schumacher about 10 years ago, goes and takes your paper data, your paper-based data, which very quickly ends up, if you're a famous person, ends up places it shouldn't be, such as the leading yellow newspaper in Europe, Bild-Zeitung. You have far less security, far less privacy if you are undigitized than if you are digitized. So from our experience, my suggestion is put a lot of effort into developing a secure, digitally secure medical system. You will save a lot of money, but you will also make healthcare far, far better. And it's a worthwhile investment given how much the United States invests in healthcare already today, which is, as I mentioned, 19% of GDP. But with that, I'll finish, and I'd like to thank you all and hope you find the rest of this more interesting than my rather boring talk, but we have really, really talented people waiting in the wings for you. Thank you.
So I would very much like to thank you, Mr. President, for such an incredible overview of what we have been doing and also the lessons that we have learned. But I would again like to point this part that what, in your opinion, has been the biggest lesson or failure we have done with the process of implementing eHealth solutions? Is there anything that we failed in a way and we learned and we did it like better, or like what has been the lesson of this entire implementation process?
Well, I think the repeated lesson is actually underestimating the degree of usage that the public, where we can expect from the public. And they use the system far more than over the years. In numerous occasions, people have anticipated, which means our technological solutions have not taken into account how many users there are, and the systems have been temporarily, but basically nonetheless occasionally overloaded, and we're still learning that we need even more storage space.
That's true. But you also have been working with some other countries and have been advising them. What's, in your opinion, the biggest struggle that countries are facing? You put it out like in your keynote speech as well many times, that having a national identity. And do you think that it's necessary to have a national identity when it comes to also providing a very safe, secure access to your medical information?
It does not have to be a national identity. It's a little easier that way because I mean, there are two aspects. One is that actually you need a secure identity. That's like the absolute minimum. It must be unique and secure and no one else can use it. The other side, but the national side is, well, it's just taken from our example and looking at other countries, is that actually the countries, I mean, the government has the resources to create a robust enough secure system. You can do it with the private sector. In fact, our system actually is has been half and half between the government sector and the private sector. I mean, they basically were in charge of authentication in a 50-50 basis. It does not have to be. It's just that you want to be sure that it is secure and robust enough to withstand the kinds of attacks and hacks that you will undoubtedly face.
Absolutely. All right, thank you for your answers. I have some great news for you as well, because our president is also joining in a panel, so you can also submit your own questions and ask what comes to your mind. But now I'm very, very happy to also introduce our second speaker, who is Taavi Einaste from a company called Nortal, who is also known as being one of the main companies behind Estonia's transformation into globally known digital state. And their vision is to build a completely seamless society by helping also leading governments in healthcare institutions and of course also businesses around the world to simplify and optimize the complex processes to tackle challenges of today and of course also to build a better future. But first of all, we're going to have a look over one of the videos of this company. So let's have a look.
Nortal is a global digital transformation powerhouse of 1,000 experts in the US, Europe and the Middle East. Known for being one of the main architects behind Estonia's transformation into a globally renowned digital society, Nortal's vision is to create a seamless society where all communications, transactions and services are effortless, leaving time for things that truly matter. We work with leading governments, healthcare institutions and businesses around the world, helping them simplify and optimize complex processes to tackle the challenges of today and build the future together.
Good morning, everyone. I'm very excited that so many of you have joined us. And of course, thank you very much to our president, Mr. Toomas Hendrik Ilves, for the inspiration. I hope that during this session today, you will also find actionable inspiration so that you're really able to take the next step in digitalization. My name is Taavi Einaste. I'm from Nortal. Nortal is headquartered in Estonia but operates globally. And we are a company that has really grown up building and breeding the most digitally advanced society in the world, the Estonian digital ecosystem. There's one principle that we use across all of the different domains that we work in. And this is, we only design and implement systems which are user-centric. I think this is a principle that is especially important in healthcare, be it patients, medical workers, or other specialists who work in the healthcare sector. And then COVID hit. I think for all of us, the one thing in common from January, February, March last year was that we didn't really know what's going to happen. And once the news and hard facts started rolling in, it became clear that this is a systemic challenge. It's a pandemic for all of us, especially the healthcare sector. In this time of crisis, everything gets tested, and so did the Estonian digital healthcare ecosystem. You have to be able to flexibly change, you have to be able to scale up, and you have to be able to support the most important, support doctors and support the patients. I will use a very simple example to show you how the Estonian digital healthcare ecosystem that we have built up over the last 20 years was able to support us. As soon as mass testing became available, we were able to use the existing digital infrastructure so that people, both patients and doctors, were able to book testing times online, get their tests, and also get the test results in a secure way so that only they can see it. What's more important during this time of crisis was that the same platform was able to collect those test results and present the data to decision makers near real time. So both for operational and political decision making, the decision makers in Estonia had very high quality data. But not only have we been using what has been built before. For example, we also built a secure platform for sharing COVID-19 test and vaccination data called SimplyGo. So that's something that we really had to come up with in a couple of months. I hope that some of this was useful for you. We have over 20 years of experience. We also operate in the US, so we know a little bit about this market. So please get in touch, and we are happy to support you in your next steps in digital healthcare development. Thank you.
Thank you so much, Tavi, for introducing your company and what you have been doing there. You said when you finished your keynote as well here that you have been experiencing also something already in US.
Sure.
You have done something. Maybe you can just give us a couple of like comparisons, like it's when you would have to compare building solutions like in Estonia here and in US. What has been the biggest, like I would say, challenges and differences when it comes to the implementation process?
Well, our clients in the US are mostly Fortune 500 companies, and with this, of course, scale is very important. So we have customers that have to service tens of millions, if not hundreds of millions of customers per day. So that really has a slightly different scale if we talk about the Estonian 1.3 million people. So I think for us, having worked in the US, the scale has been perhaps one of the most interesting things to learn about.
All right, but do you think that this is still like as we discussed also with the president before, like is it compulsory to have an electronic identity when it comes to accessing medical data, or what could be the alternative there? Like how can we access data if there is no national or
Sure. Well, I think from the president's message, the key here is to have a secure identity, and there are different ways of achieving this, and we see already also let's say private companies offering different digital identity solutions that you can also use in the healthcare space. So I think this is one. And I think overall, our approach always has been that when we do implement solutions outside of Estonia, it's usually what we call inspired by Estonia. It's not usually exactly the same thing.
I have experienced that a lot, that if you travel to somewhere that they would just bring it up like we would like to be like Estonia or do things like you do here. So definitely that's a very good point here. All right, that was it with the questions to you. I'm now introducing our third speaker, who is going to be now Meelis Lang. And Meelis Lang works in Helmes, and he works as Chief Information Officer. And Helmes is an international custom software development company who builds complex systems that runs today's business and organizations. Throughout their 30 years history, they have served more than 500 companies, organizations, and the government agencies as well here. So let's have a look.
Hello. The problem we see today in healthcare is that the service flows are inefficient. I'm Meelis from Helmes, and today I'm sharing our experiences of some of the ways how we have helped to solve this problem. Hospitals today already have existing software solutions, but these are hard to use, being old and legacy. These systems are not well integrated with different other parts of the software. Helmes customizes these service flows for maximum efficiency by optimizing and upgrading the existing legacy components and by integrating the new module with the surrounding software. And I'll give you 3 examples. First is a booking module optimization that we did for multiple hospitals who already had existing software. So the challenge here was that there were many expensive devices that were underutilized. There were many patient no-shows, and this caused long queues for other patients. The solution to build a digital bookings module with a central hub that manages and arranges the appointments and resources, and have a smart algorithm that enables double bookings that reduces the challenge of no-shows. The result? almost 70% increase in the number of CAT scans. And the annual gain per one hospital was able to serve more than 30,000 patients and do more than 200,000 studies. The second example is about procurement solution that we did for a US pharmacy network. In this case, the challenge was that the existing stock management software was inefficient and cumbersome to use. So a lot of work time was wasted, and also this caused many lost sales opportunities. The solution to build a flexible modular procurement suite that had an optimized workflow, easy-to-use sales module, and a toolkit for analytics for procurement. The result, a 10% increase in procurement efficiency. Third example is about dictation module that uses speech recognition software. In this case, the challenge was that there was an increased demand for radiology services, but the number of radiologists was limited. So the solution was to custom integrate a trained speech recognition module specifically for radiologists. The result, a productivity increase of 30%. These were just 3 examples out of many, many more service flow optimizations that we have done by custom modules and smart integrations. And this has saved so much time and money for hospitals and also enabled to provide so much more efficient healthcare for the patients. Thank you.
So thank you also for your presentation here. And I would like to ask from you, who is your ideal customer? Like, I mean, as you said also that you work with many different countries, but who would be your the most perfect customer in a way?
Well, that's a hard question, but fortunately we have thought hard and long about this. So being in the market for 30 years, we've seen over 500 different organizations. And what we have understood and learned that there is no perfect customer, but there is an excellent and efficient engagement model. So what this means is that it's more important to find and match the engagement model to the organization needs. So I can give a few examples. For example, we are working with a large public sector organization, OECD, with one engagement model. At the same time, we're working with an over 100 years old company, a large, huge corporation leading logistics named Kühnenagel. And also the third, working with fast-scaling startups such as Interpretify with a third engagement model. So it's all about matching the engagement model with the organization.
All right. But also you have some experiences in US market already. Maybe you can go a little bit more deep into that as well and then talk about of your experiences in US market already.
So regarding healthcare, we've been in the US market for almost 5 years. We've done multiple projects, but there are 2 ongoing engagements, out of which one is for the Institute of Motion. We can't disclose the second name, but the solution is it is designed to get FDA approval, and it works with the insulin pump monitoring and analytics software. And also in the US market, we have extensive experience in the insurance industry, where we are the trusted partner of a leading insurance company named Solera for almost 10 years.
All right, that's incredible. And that was, again, all my questions this time. But again, you will continue with a panel discussion there. And now I'm also happy to introduce our already fourth speaker today, who is Kevin Dammero, who works in a company called Cybernetica, and who are very much responsible for also the entire data exchange between different medical platforms and of course, also all the security aspects. So let's have a look over their video, and Kevin will step on the stage.
Knowledge is the driving force of transformation. We believe that mathematics is the language of the universe, and cybernetics is the poetry of the future. As the minds behind beautiful systems and the architects of a smarter and securer world, we make no compromises in building the impossible. By creating order from chaos, we dig deeper into the core of things. Research and development are in our DNA. We rely on this background and the profound objective truth in shaping the world. We see ourselves as the guardians of cybersecurity. By initiating changes in this field, we shape the world. We believe in long-term partnerships built on trust and transparency. We work in close collaboration with our customers for the best result. Our technologies are the foundations for digital societies, creating unique value for governments, businesses, and citizens. Our products enable the identification of individuals in cyberspace, securely transfer data between stakeholders, and improve the situational awareness of our customers. We have successfully digitized areas like tax and customs, built smart grid solutions, and more. Today, our technologies are used in more than 35 countries around the world. For over 60 years, our mission has inspired us to thrive and grow into a global presence. We are committed to delivering tomorrow's technologies today.
Hello and welcome on my behalf. I am Kevin and I am from Cybernetica. We have been inventors and engineers of mission-critical solutions since 1960, as we were initially founded as the Institute of Cybernetics under the Estonian Academy of Sciences. And as we were later spinned off into a private entity, we started working on solving complex issues and challenges in governance, healthcare, and for enterprise. And this has set us up to be able to design, architect, develop, and deploy solutions for healthcare, both from a larger ecosystem perspective with key enablers, but also with more dedicated and targeted solutions that require heavy analytics and intelligence. Some of these ecosystem pieces that we work on and have experience in are, as an example, interoperability and secure data exchange. This is something that we've been working on for 20 years and have been the leading thinkers behind the Estonian X-Road model and have implemented this in numerous countries around the world. Another ecosystem level example is from secure authentication and digital signatures, as we have worked on this for the past 2 decades in delivering ID card pilots, in developing mobile-based solutions, and consulting with governments all over the world. And some examples of more specific targeted solutions are from clinical decision support tools to encrypted genome data storage and querying mechanisms, and of course to information security and privacy risk analysis for different solutions and projects. What we believe today is that a patient-centric experience without compromising security or privacy is possible. And this is possible, we believe, with 3 key areas or components in place. One of those is a health trust ecosystem, an eHealth trust ecosystem that makes it possible to enable data liquidity and shared data among independent stakeholders and create bridges between silos. The other area is in information security and privacy by design, where we have a methodology that enables to create solutions and enables to unlock the intelligence analytics necessary to create these services in a way that does not infringe on the integrity of the data nor on the privacy of the individual. And finally, we believe that achieving a patient-centric experience and also bridging the productivity gap in healthcare is only possible if we build a coalition of like-minded entities. So if this makes sense to you, we are very happy to discuss further. Thank you.
Kevin, again, I would like to thank you, and your keynotes are always absolutely fantastic. I would like to ask a very concrete question from you. What's your solution for the US market? What do you offer for them?
Absolutely. Thanks a lot for that question. So as I mentioned, we work in a number of different areas, providing both ecosystem pieces as key enablers, but also specific solutions targeted to overcome complex challenges. So more specifically, what we can provide is interoperability and secure data exchange as a platform, or soon even as a service, or digital identity in a way that works on smartphones without having to use any physical security devices on the user side. And of course, looking at our information security and privacy by design methodology, we can unlock the sort of analytics and intelligence layer in healthcare, but also in other areas that's necessary to actually create solutions that can help prevent disease, to help solve diseases and illness, and also work in the sort of aftercare phase of the patients.
All right. Are you already providing some solutions for the US market at the moment as well, like working with some international organizations that especially deal with the medical information and so on? Or are there any examples that you could bring it up for our listeners today here?
Absolutely, and thanks for the question. So in other areas, we work with DARPA and then US Air Force as well, doing a lot of sort of groundbreaking work around cryptography. But in terms of healthcare, we work, as an example, with the Center for Medical Interoperability based in Nashville, and had a project together with CDC, our own personal protective equipment, in the sense of exchanging data between independent stakeholders like hospitals and gaining information about what their sort of level of equipment is in terms of masks, gowns, gloves, and so on, so that you know exactly where you have stock of something.
That's absolutely incredible, and I wish you very best luck with also integrating all this, the new systems and solutions again, as the world is changing all the time. And definitely, if you want to reach out to the company, then you can easily do that later on as well. And again, the Q&A session will follow just after now. So I'm happy now to give the floor over to my lovely colleague, Florian Marcus, who is going to start with our very first panel here today, where you can, again, send your own questions and discuss about what's happening in our e-health sector here. So over to Florian.
Meet 3 Estonian e-citizens, Lee, Martin, and their son, Hugo. Lee receives an email notification through the state portal that her driver's license is about to expire. To renew her license, Lee needs a medical certificate, which is issued after a medical checkup. Before going to the doctor, Lee first opens the patient portal to fill out a health declaration. After she signs it digitally, the declaration can be accessed by the doctor. It gives her the information about Lee's health in advance. The pre-filled declaration makes the visit quicker. The health certificate is immediately sent to the National Road Administration, and all Lee has to do is apply for license renewal using the information system of the Road Administration. This will only take a few minutes, and in a few days, she will receive her new license by mail.
Well, hello there. My name is Florian Marcus. I'm a digital transformation advisor at the e-Estonia Briefing Center. I'm greeting you from arguably one of the most comfy chairs in all of Estonia. And in 4 of the other most comfy chairs, we have 4 very esteemed guests that you've already seen speeches of earlier today. In this first panel, we want to map the current state of e-health. Now, of course, we have the former president, Toomas Hendrik Ilves here, and also the company representatives from Nortal, from Helmes, and of course from Cybernetica as well. I would like to first set the stage, perhaps with you, Mr. President. What challenges do the European and American healthcare systems face at the moment? What are the differences, and where do you see some overlaps where maybe we can also exchange best practices?
Well, I think the challenge for Europe at this point is actually going from individual national solutions and to actually create a common health space. Estonia is the only country, together with Finland, that has digital prescriptions that work across national borders. This should work all across the European Union. So too, so that if I get sick in Brussels, I can take out my Estonian doctor's prescription in Brussels. Which now only works if you're a Finn that gets sick in Estonia. But even beyond that, I think what would really create a common space would be if I happen to get sick in, say, Athens, Greece, I go to a doctor, I identify myself and authorize the doctor to look at my medical records, and he will get it all in front of him already translated into Greek, which is, it's a no-brainer at this point to do that. So in fact, the healthcare, with all the, who pays for it and all that can be dealt with, but the fact that the information is available across a common space in a secure way is what we should be striving for. Now, in the United States, it's, of course, where you have 30% of the population, roughly, from what I understand, is even uninsured, that this becomes a much bigger, more daunting task. The HMO system in the United States, which, for those who are enrolled, works rather well, but what is necessary is to get them to adopt the common standard for data exchange for the same kinds of problems. So if you're from Pittsburgh and you happen to get sick in Oshkosh, Wisconsin, that those data are easily and securely transferable to the person authorized to see them. And so I think in the US, we need since there is no national system, there's no real, at the state level, there's no real system. So you need to actually get the HMOs to really begin to create a framework in which to share data.
Just a very brief follow-up there. Do you feel like on a structural level, the US might actually be better set up to solve its own challenges in comparison to the EU, which has to deal more with several national governments on that level? Would you say that's fair?
Well, yes and no. What we do have is in Europe, we have over the years adopted lots of common standards, which makes the data exchange much easier. We do have a directive that actually mandates every government to offer a digital identity. It's not mandatory, but you
start. Yeah.
So you have that, whereas that's completely missing in the United States. On the other hand, it's clear that private sector cooperation is far more effective than national governments agreeing to things, which is a much longer process.
I would like to start with questions to the company representatives, maybe to the audience from left to right. So to Davi as the first, but also the same question was already sort of touched upon during the Q&A partially. But what experiences have you been able to gather in the US market so far, and what do you think where the Estonian know-how can be most easily or most adequately applied?
Well, I think, again, scale is one of the keywords I would use. So, the massive amount of users that, can get on a platform very quickly, once it becomes popular, that has been a very interesting engineering challenge for our team. Coming from a country of 1.3 million people. So I think that's one, but that's technical, and that's something you can solve. You put smart people in a room and they come up with a solution. As far as we understand, the huge difference comes from the fact that a large share of the U.S. healthcare is provided in the, let's say, insurance-created silos, you could say. Some of the silos are very large. It could easily be, 30, 40 million people. And you have huge discrepancies between the quality of the digital ecosystem of those silos. So, we have very good examples from some of those insurance providers who have data is moving between the patients, the pharmacies, the healthcare providers, but you get into the challenge the moment you leave that heavenly space and you want to go to another provider.
How dare you? Yes. So,
absolutely, and I think this is very well reflecting the problem that we have in Europe between countries. So the problems are coming from very different sources, but they're similar. So interoperability at the end of the day is the same. I think that there's hope. What we are seeing is and this is again coming from a technical side, but sometimes technological innovation can help also policymakers and industries to change. So what we are seeing over the last 5-6 years is a interoperability framework called HL7 FHIR, which has gained a lot of traction on both sides of the Atlantic. So we are seeing countries, major countries in Europe following this standard. For example, the German digital prescription, which is hopefully going live soon, is following the FHIR standard. And we see many of the federal agencies involved in the policymaking for the US healthcare. They're also embracing the same FHIR standard. So I think what this enables, it enables companies to build solutions that can work on both markets. And that can be an enabler also for the policymakers. Because as soon as the technical tools are available, it's easier for the policymakers to follow through on interoperability as well.
Mm. And if I remember correctly, Nortal also helped Germany a tiny bit in the direction of e-prescriptions?
That's true. One of the most successful pilots, was done by us, and we even received a innovation award for that.
It's very difficult to keep that happy face behind. Yes, thank you very much. Meelis, you've already shared some of the insights, but maybe you want to expand on your experience in the US market and the sort of clients that you've worked with so far, and maybe also what you're looking for in the future, what kinds of clients you would really love.
Yeah, so since we're building business critical software and we're focusing on integrations, smart integrations. So as I told earlier, it's not like you don't have to replace often the whole software. You can do custom modules, smart integrations, and the expertise lies in how to integrate this medical equipment with these different systems. And as Taavi said, the medical health standards, how they interoperate, are already there. They are proven. The device manufacturers are providing these devices around the world. There are the similar devices in Europe as in the US. So having this experience, integrating different hospitals, hundreds of different devices with different systems, that's the experience you can take anywhere. So I think these international standards help, and there are so many proven track records of how to do it.
Kevin, would you say that's the same for Cybernetica as well, or have you, because you're coming from a slightly different angle, the data exchange nature, would that be a different experience for you?
So I'd say we view healthcare in the United States as an area that we sort of distinguish in three perhaps areas or layers, starting from the sort of infrastructure or data layer, as has been mentioned in terms of interoperability, making data liquidity possible so that you can exchange it between counterparts that are independent stakeholders, right? They have their own organizational boundaries, a mandate, their own systems, and so on. And usually they have low trust between each other. So that's one area that we look at quite intently in terms of how to enable these trust ecosystems in healthcare and wider in the United States, so that you can actually unlock this data. And the other layer is in intelligence and analytics. Once you have this data available in some sense, you need to have ways of being able to create insights, actionable insights from this data. And in healthcare, this can mean examples in prevention, like if you're able to, in a discrete way, analyze a patient's data, for instance, how their asthma conditions have been treated, you can detect misproper treatments, and by that you can also prevent future sort of repercussions for that individual. And of course, finally, it's this question about creating those sort of applications on top of the data layer, and the sort of intelligence that you unlock from there is the applications that actually engage with the citizen, with the patient, and give them this sort of patient-centric experience. So these are areas that we look at, and we sort of try to do this from a larger ecosystem perspective.
Let me just add one thing. Yes. Basically, one thing that I think the audience should know is that the technical side of the solutions is the easy part. The policy and political side is where it gets messy. I mean, just the one case of cross-border interoperability, I proposed to the Finnish president 10 years ago, and he said, "Great, let's do it." The technical side of that would have taken 3 weeks at most, if not much less. It took 9 years to go through all of the bureaucratic and political problems that were entailed. So the technical solutions are no-brainers for smart engineers. The problem is to get the policy people and the bureaucracy on board. That's what I would just say for, you guys can come up with a great solution, but unless you get the Congress or your state legislature or your state government on board, even if it's a private sector solution, there's enough legislation in this area to be able to stymie things for a long time.
Yeah.
If I may add, I to a degree agree with the president, but to a degree maybe differ as well, in the sense that technological solutions are easy once someone's done it or sort of shown you how to do it in some sense. Yeah. But I agree that policy and cultural issues are unique to each country. But yet again, information security and principles of information security, principles of privacy, these are relatively standard or relatively universal across different democratic countries. So good solutions that have been developed in other countries can be transferable as long as they are built on the sort of best practices.
This actually brings me to a question that I wanted to ask everyone in the room, and I think we can start from left to right again, just to give everybody a bit more time to think about the answers. Do you have the impression that the different stakeholders in the US, whether we're talking about the patients/citizens, the healthcare providers, the politicians and the legal side and so on, do they share the same concerns about implementing solutions as the European counterparts on this part of the Atlantic? Or do you feel like there is a structural difference in expectations or hopes or fears with regards to healthcare? That would be interesting to me.
My experience, privacy issues are far more important in the European Union, even to an unrealistic degree where people don't quite understand that these have been resolved, but there is a Luddite, a priori Luddite inclination among lots of policymakers, especially legislators, because it's a way to get popular. Whereas in the United States, it does not seem to be as important. You just look at the attitude towards GDPR. I mean, the U.S. has HIPAA on healthcare, which is a big step forward. But I mean, this overall concern with data privacy dominates in Europe and not in the US.
Yeah. Tavi, your thoughts?
Well, I would definitely agree that I think that the number of cookie acceptances in the European Union has exploded over the last few years. I think it's a different question of how much good it has done. I'm pretty sure that it has had benefits, but I don't think that it has reached the intended benefits. So I think that there's still a way to go. I think in the US the discourse is around a different axis, which is much more concerned about the individual versus state. So you have also the two opposing parties, very different philosophies, and I think many of the discussions also around healthcare solutions, healthcare provision, healthcare financing are stemming from that discussion, which it seems to be steering rather more apart than converging last 15 years perhaps. So I think it's a very different discussion compared to what's going on in Europe.
Very interesting. Meelis, what are your observations?
Well, I'm not an expert on the legal side of things, so I can just discuss from the side of doctors and the administration. So taking these new solutions, especially when they're like innovations into use, it's as with every system, there are like the early adopters and the late adopters, and often the younger doctors are the more enthusiastic, and they try to test and try out these solutions, and this gives kind of confidence. The testing and the working solutions give confidence to others. So someone has to be the early adopter, and kind of give proof and examples how to do it. And then the more senior doctors and the other hospitals can kind of join. That's how innovation happens. So I think it's more about who's the early adopter. And as colleagues said, the standards and the proven methods are there. So, and the GDPR, the data privacy issues, this has been so strong in the European kind of health industry, that GDPR didn't change anything in the kind of hospital systems we have built. It was already at this level. So it was just nothing had to change. So all of this can be taken, and it's more about who's the early adopter, who's leading the innovation.
And I think it's fair to say that being the first one is not necessarily, I mean, there's nothing inherently good or bad about being first or second. It's just that the experiences are properly shared and assessed, and that we can learn from those mistakes as well. I remember that some of the early Estonian solutions, not just in the health sector, but also elsewhere, were simply not built to anticipate such a massive interest from societal side, and you just beef them up for next year. So there's nothing wrong with taking a misstep and going forward from that. Absolutely, Kevin.
Just from the technical side, beefing up, as the president said, technology is not an issue. You can beef it up in 3 hours or 3 days or 1 week. It doesn't take a year. These are counted in days if you put the brains in the same room. So this is not an issue.
I think in general, when we're talking about digitalization, size is not a question also for the implementation stage, because, well, that's the whole point of technology, to make it scalable, right? So yeah, I think that's usually a moot point when people ask, what does the US have to learn from whether it's Estonia or any other country that is smaller than them, and the other way around, can lessons from the US be taken to Estonia as well? Absolutely, does not depend on size. Kevin.
I agree with the conversation that in the sense that if you've built solutions based on best practices and a sort of good policy, and you scale that up, then you get sort of scaled up good policy in this regard. And what we've seen in the United States is that actually quite a lot of people, both on the state level in different departments and sort of and on the federal level, are mindful about privacy issues and data security issues. But maybe the challenge in the United States compared to, say, Europe is that a lot of this debate is more driven by private sector, which is not a bad thing necessarily. But in some cases, you can see that for the private sector, it's more useful that privacy issues are not at the top of the agenda in the country and top of the legislature. So because their financial sort of incentives are closely tied to that. And that might be a reason why in the United States we perhaps see a bit less of these topics.
Yeah. Tavi, you had a comment, I think.
Well, I think, looking into the future and thinking about solutions, one of the important understanding, I think, that more and more people are becoming to realize is that privacy is not a one-size-fits-all solution. Mm-hmm. So if you take the general population, you have the people who are extremely liberal with their data, they don't care, and then you have people who want everything to be secret, and then you have a large chunk of people in the middle. So I think that the future privacy solutions, perhaps also regulations, but I think more importantly solutions, you have to have the ability to provide people with dynamic privacy options, and that's a challenge today, but it's doable, and we're working on a couple of concepts to enable this, because I think also the same cookie acceptance, it has really created privacy fatigue. It has really done the opposite.
Mm-hmm. Mm-hmm. Mr. President, you want to add something?
Well, I want to say basically, really, if it comes down to the difference between Europe and the US, I would say that Europeans react emotionally to issues on privacy the way Americans react emotionally to issues of a state-issued ID.
Yeah.
I mean, the reaction in both cases ranges from, acceptance and saying this is normal to really wild opposition. But the ID part doesn't bother Europeans, and the privacy part, as we can see, aside from Colorado, I mean, GDPR, which adopted a modified GDPR, it's not been a central issue in the United States, despite, you think it would be. But so I think that's, to understand the emotional component, too, which, of course, is very important for policymakers who are not going to make decisions if they think it gets people and voters annoyed or riled up.
Absolutely. Kevin, just very quickly.
I just wanted to say, I think the privacy issue actually is quite significant in healthcare, in the sense that if we think 1/6 of healthcare or 1/6 of the GDP in the United States is healthcare, and that's not necessarily a good thing, because this increase over the years has not come from productivity, but just wage increases, meaning that in terms of consumer price index, healthcare costs have been one of the steepest increase. And a large part of why this has been so is that you don't have productivity gains in there. And this stems from also privacy and information security reasons, so that if you're able to actually automate and create this intelligence and analytics from the existing data, you can create step-by-step additional layers of productivity. So you don't need the smartest super AI on day one, but maybe just automate a task that humans do on a regular basis. And that's already a significant leap.
Absolutely. We have around 3 minutes left, and I've got 2 questions for you. So if we can make those 2, you will all get ice cream from me afterwards. You can hold me to this. From the audience, what kind of change, knowledge, or research development would you like to see in the world so that your products could succeed on larger markets? I would just ask the 3 company representatives this. Tavi, if you could mention one thing that would help you boost Nortal.
Well, I think research into how to work with people so that they would make rational choices for their own benefit, which is, I think, a very big ask.
Sounds like education.
But of course, there's a lot of research into different techniques called like nudging, etc., etc. Like, how do we teach people? How do we educate people about the benefit of digitalization, so that they would be more willing to take the journey? Because I think that there's a huge gap in terms of what could be achieved with simple tools today and what people are actually using. And again, like, this is nothing to do with technology. This is social sciences. So I think that's a huge area where we have improvements that can be made.
Meelis, if you want ice cream, let's go.
I think it's like if everybody could learn how to delegate things to the system and just ask for it. Why should any human do stupid work that any machine can do? Learn to delegate to the machines. And as everybody said, technology is not an issue here. It's just ask and it will be done.
It's already
Delegation.
here. Yeah, Kevin.
So I'd say maybe what we see is that if people knew more about information security and sort of privacy, sort of solutions to privacy challenges, then a lot of the sort of backlash or sort of rejection or resistance that we see to these solutions would not exist, in the sense that they would understand that most of the concerns they have in their heads have actually been thought about and actually been solved.
Now, finally, to all 4 of you, again from left to right, if there was one aspect of the Estonian e-health system that you would like to see both in America and around the entire world, which one would it be?
A digitally secure identity, because not only healthcare.
That's the foundation. That's fair. Yeah. Tavi.
Well, I think interoperability between systems. I think that's key for actually benefiting the people.
Very well. Meelis.
I would go with the same. Infrastructure first. That enables everything else and doesn't stop the innovation. So it's an enabler.
Thank you. Kevin.
I think we're completely in sync in the sense I agree. Ecosystem sort of level, these foundational enablers.
So there you have it. Thank you so much to all of our panel participants, and I am handing back over to my colleague Annette Numa. I hope you'll have fun with the next presentations as well, and we'll see you later for the second panel too.
Thank you so much, Florian, and of course also the other speakers for such an incredible panel. I learned a lot, and I do sincerely hope that also you did. But now I'm extremely happy again to introduce our next speaker, who is going to be Aina Aaviksoo, who works as the Chief Medical Officer in a company called Guardtime. And they are the Europe's leading deep tech company that was founded already in the year 2007 to support the Estonian government in building solutions that would allow information and process processes to be validated without centralized trust authorities. And one of the flagships also products today is the vaccine card solution, which I, by the way, have already used, and we will discuss that later, which is a distributed data exchange platform for vaccination campaign management. So, Ain, the stage is yours.
Hello. It's a great day, isn't it? We have all survived the dark times of COVID pandemics, and the hope is on the horizon. Yes, I am talking about the vaccination and the vaccines. And personally, I'm humbled and really surprised by the research and development efforts and the ingenuity of the companies that have delivered us those vaccines in less than a year, which usually would have taken 8 to 10 years. So let me tell you what Guardtime, the cryptographic engineering company established in 2007 in Estonia, is adding to that in order to have the authentic vaccines available and also vaccination campaigns efficiently managed during now very urgent times, but also in the times coming. It's a result of one-year development together with the Estonian and many other governments, also with the WHO. It's based on the technology that has been field tested in mission-critical systems in other domains. So I would start by asking, so what do you think does it take to make the authentic vaccines available in the right time, at the right place, to the right people? So it's a huge logistical exercise that starts from the manufacturers, so the supply chain throughout to the last clinic and everything in between. And then you need to know that the people are at the same time in the same place where the vaccines are. So it requires coordination and collaboration between small clinics, public health authorities, manufacturers, distributors, and then also several people and organizations around that. So in order to enable all that, you need situational awareness. And this situational awareness comes from understanding where the vaccines are they authentic, and also what is the need for vaccines. So because for COVID vaccines, we know that it might not be enough to have just one shot. It might be that you need 2 vaccinations. It might be that you don't get those vaccinations in the same location. It might be in different clinics, in different states, or even in different countries. So that later on, you have to be able to prove that you have been vaccinated. Again, this may be for travel purposes, but this may also be that if you go to another healthcare provider and they are making a decision upon a clinical work that they have liability, do they know about your previous health? So that what Vaccine Guard does is it enables all those different stakeholders to have the same single version of truth about your health, and it also empowers citizens to carry basically in their mobile phone their health record and allow the others to see that information about themselves when they need. So I will finish with saying that if this pandemic is over one day, and I hope it will be, what will be left is the digital infrastructure and the services that do empower people, be it your vaccination or other health information, and you can enjoy health services across the world, and you can release that information to others when you want it. And that is what keeps us ticking with, this hope in the future, myself and my colleagues at Guardtime. Thank you.
And it's always fantastic to learn something new for you when you make your presentations here. Luckily, this time our audience have been pretty active this time, and we have received a couple of questions also from the audience side. So I'm going to go ahead and ask them from you. So tech companies are racing to build smart vaccine passports. What makes yours better than the other ones? So why choose Guardtime?
Because we don't build vaccination certificates. Because we build solutions that empower people to carry their health information with them, and the certificate, be it for travel purposes or for care continuity, is just one part of that. Because it is not only the document that the others have to trust, it is also the information that it carries. Do you know that this vaccine actually came from legitimate source? I know that in many countries that is a problem, and there is increasing probability that it might be an issue in the future. So we guarantee the integrity of the whole process, not just one document.
All right, and like going on with the trust part here. So the other question: how can I make sure that the data from vaccine card is trustworthy and not fake?
Well, we do use a specific KSI blockchain for that, but we don't keep the data in the blockchain. We use the technology in order to basically have the breadcrumbs across the processes and across the individual artifacts that are created through that. So that if the vaccine comes from one source and then the healthcare provider has been legitimately given authority to provide the vaccination, so we know where this vaccine came. We also know how this healthcare provider came to be to actually be able to vaccinate you. And then we combine that information together. And we can also feed intelligent reports back to the public health authorities by not using any of the personal identifiable information, but actually helping to coordinate when and where those vaccines are needed, because that is what makes the system reliable, that we use cryptographic links, not personally identifiable data for that. Right. And you don't build centralized databases in order to have this information.
Exactly, absolutely true. I also said before that I have been already using vaccine card solution when I was traveling last week, and part of my travels were like completely fine. So in some countries, not going to name any here, they were really accepting and like just looking at my vaccine card solution, and they were like, okay, you can go. You don't have to write any documents to have the PCR test. But there were still countries who were like very much struggling what we can do to make this process faster, because there's a question also very similar to that from our audience, like how long would it take that to create a solution that would be worldwide database acknowledged by the governments? Like right. How far is the right. Because I know that the European Union is currently already the green certificate what we have, but yeah. How long would it take for the world?
Well, first, don't start building databases, because that takes far too long time. Start building services. And distributed and trustworthy information is what we enable to be used in services, which means that we may have just the information about the unique vaccines that have been, what we call them, digital twins by manufacturers. Then the next point is that when they arrive to a country, so we can link that these are actually vaccines that are allowed in the market. And the third point might be that there is a healthcare provider which uses the legitimate vaccine. So we don't need all that information in one place, and you can start building this simple use case within weeks. And then if you want more sophisticated services, for instance, you want to monitor the effectiveness of those vaccines, so you collect additional information after the vaccine has been given. That takes a little bit longer time. And again, you don't need to collect all the patient data into one single location. You can start making inferences from the very first, let's say one clinic starts using that, and you can basically start with a simplified clinical trial. And that is something that you don't require months or years to build.
The last question that I have for you also, that I heard that you're currently working with a project called COVAX with also low and middle income countries. Maybe you can just very briefly talk about these projects as well.
Yeah, I'm happy that the distributed information systems can help highly developed countries who have very fragmented healthcare systems, like US and well, actually even my own Estonian country, tiny but still fragmented. But also it can enable countries with resource-constrained, low and middle-income countries, which need authentic vaccines, which also need some quality management systems. So you don't need to build brick and mortar healthcare systems, but you can build digital infrastructure. And that is what we are collaborating with the UNICEF, and we hope that all the 193 countries will have vaccines available in the coming months, and we can support that with our tiny bit.
My fingers are crossed for that. Thank you. All right, we're moving on now to the next speaker, another company called Certific, and which is represented by Liis Narsku, who is also the co-founder and CEO of this company. And just briefly talk about the company. So they provide a digital platform that enables certified remote medical testing at scale that has been founded by different researchers, tech experts, entrepreneurs, and to end this year-long shutdown caused by the Covid-19 crisis by providing home testing services here. So let's have a look.
Good afternoon. Extremely delighted to welcome you all here on this wonderful day. So what do you think is in common for these three things? Hummus, your dog's nose, and your ear. I assume you don't know the answer to that. They all give you a negative COVID test result. Certific was born out of the need to solve two key issues. Medical diagnostics, especially COVID testing, is still very time-consuming, expensive, and cumbersome. You need to go to an expensive doctor to do a simple test that you then need to wait for 24 hours, and it's all still very expensive if the state is not paying for the tests. The second issue is trust. Before coming here today, we agreed that I will do a rapid antigen test. Luckily, I'm an honest person, and the photo that I sent is actually my test, and I did not stick it in the nose of my colleague. But imagine a situation where the incentive to cheat is so much higher. If I want to see my favorite artist, if I want to go to a football match, people are extremely inventive when it comes to forging these systems. The solution, we are solving with Certific both of these issues. Certific is a mobile app that, as an end result, gives you a medical certificate to go to traveling, to go to events. But in the process, before issuing the certificate, what we do is that we verify your ID, we verify the test, we verify the sampling procedure by asking you to self-record a video, and we issue a medical certificate as a result. We do that both for rapid antigen and PCR testing currently. We have been on the UK market with home-based PCR test verification for only 3 months, and we have done over 10,000 certifications so far. And we do have a champagne type of problem currently that we've been completely sold out because the market, the need is so big on the market that we cannot actually guarantee all the results. The plan, though, is to quickly exceed and scale up in the UK, in rest of Europe, and then in the US. Our mission is to decentralize diagnostics and to enable fast, convenient, trustable, at-home testing for as many people as possible. And we definitely will not stop at COVID. We usually say that COVID was just an initial inspiration. There are plenty of at-home tests that are done by an expensive medical personnel only because there is no trustable, certified home testing system in place. One use case being, for example, anti-doping, another one, clinical trials. I'm Liis from Certific. Thank you for listening, and I'm happy to answer any questions.
Thank you, Liis, for introducing your solution here. And thankfully, we already have some questions again from the audience side. So the first question that I have for you is that maybe you can explain a little bit the entire process of ordering the test from Certific, where one could order one.
A good question. First, I think it needs to be made clear that Certific is not a test reseller, and we are completely test agnostic. So we certify any test that is approved by authorities. But if you do order the tests that are provided by our partners, then you order the test, be it a PCR kit or a rapid antigen test. You receive it to your home. You go to the app. You identify yourself. And as I mentioned in the pitch, you self-record a video, and while we verify the whole process, and at the as the end result is being a medical certificate.
But you previously mentioned to me when we had a conversation that you already have some kind of like testing or something in UK for also organizing events. So my second question, and also what we have received from our audience here, is that is there any kind of cases already that there is an event organized thanks to this solution in some countries as well?
Yes, we are currently, we actually have been for the past 6 months already been in discussions with one of the largest concert organizers in the world. We are organizing Founders Forum in 2 weeks' time, which is a 500-person event where we do rapid antigen testing, or people do the testing through our system before going to the event. And then when they go to the event, they just basically have to scan their QR code. Nobody knows what the result is, but they just get an access or no access.
So it doesn't only have to be, of course, also some kind of very public event, but it could be also your birthday,
it can
your
be
wedding
weddings,
party,
it can be summer days.
And
actually, we have a lot of questions and need from the market asking for organizing company summer days, because companies very often they want to guarantee that their employees are safe, and they go far and beyond even from the government requirements.
Yeah, absolutely. And I see this going that way as well, because the summer is approaching here and many people would like to see each other again, and many people are going back to the office. So I have also heard that in UK, they ask you to provide a test again in the beginning of a week so that you could be working from the office. And this is what we have been missing for quite some time already.
Yeah, us in our office, we have been testing since last September, like 4 times a week, all of us.
What will happen if someone was tested positive?
Do you mean at the event?
No, I mean like beforehand. So it's like.
Well, then it's.
Are you informing someone there?
Yeah, the doctor will be contacting them, and we usually guide them to the national kind of test and trace system. But of course, what our system guarantees is that that person doesn't go to the event. So when you do at-the-door testing, how do you send the person home who is positive? Like, how do you do that? Do you wrap them in a bubble wrap and then put them on a public transport? You can't do that, right?
They just can't come.
Yeah.
Okay, let's keep the fingers crossed that we're going to have more and more negative test results in the future. And thanks for your solution. Definitely, we can discover these negative tests and positive tests also a little bit easier in a way.
Thank you.
But now, the last cherry on a cake here is Komti Shankar, who is the Chief Revenue Officer of a company, Viveo Health, who is also an award-winning company, eHealth startup, whose mission is to bring digital health to 1 billion people. You heard it right, 1 billion people by 2025. So let's hear about their ambitious plans.
Why can't healthcare be this simple? We are all looking for faster, simpler, and safer ways to see a doctor without moving away from work or stepping outside from home. With Viveo, you have instant access to doctors and health professionals. Whether you need to quickly talk to a general practitioner or consult with a specialist, meet the selected doctor online or offline, it's your choice. Worried about data breach? Don't be. We are end-to-end encrypted and compliant with GDPR and HIPAA. Say goodbye to long waiting times and worrying about your symptoms getting worse. Our doctors are at your service at all times. Receive immediate treatment and transform your physical and mental well-being for good, all from the comfort of your own home. Healthcare in your pocket. Download the Viveo app today.
Hello everyone. I'm Gomti from Viveo Health. The World Health Organization tells us that half the world's population still doesn't have access to affordable healthcare. When the pandemic hit us and COVID-19 came, this reversed decades of healthcare progress and exposed a lot of inefficiencies. Viveo Health realized a need for an affordable and a contactless digital health service, so we developed our own healthcare solution. Today, Viveo Health's mission is to provide digital health to 1 billion people by 2025. And how do we do this? We want to be in 30 countries. Today, we are in 7, but the plan is to also be in the US soon. What is our solution, if you ask me? Viveo's solution enables doctors to effectively set up a clinical digital practice very, very easily and quickly. And for patients, we enable quick and affordable healthcare. It's almost like having a doctor in your pocket. We have the best technology. We are very easy and quick and secure to use. We have full compliance as far as the US market is concerned. We are HIPAA compliant, GDPR compliant, end-to-end encrypted. Viveo has recently won a lot of awards, which we're really proud of. We are the only company that MasterCard has chosen in the health space, for their Lighthouse program for creating social impact. Viveo was also voted the best telemedicine platform from over 3,700 other telemedicine services by Status Insights. And after all of these awards, I mean, we've been really, really fortunate and lucky to partner with a very, very influential companies in Estonia. We are helping these companies to fight the pandemic by keeping their employees safe by providing our award-winning contactless telemedicine service. Today, there are over 200,000 people across hundreds of companies in Estonia, India, Baltics, Mexico, and these people have opted to choose Viveo as a service for their customers. Our customers are growing as we speak, and when it comes to the US market, where we are looking to enter soon, if you're a company that's looking to develop their own telemedicine service, look no further. Look us up and chat us up. We are looking to enter, US very soon, so we could help you franchise our service in the US. We are also very, very successful in the insurance business by providing our service to a lot of insurance companies by making them much more efficient and effective, therefore more profitable by bringing their claims ratio down by as much as 40%. So the loss ratio decreases. The customers are super happy because they get quick access to a doctor, as well as the customer churn reduces and you have long-term contracts. So if you're a US company who's in the insurance business, or if you're a broker, that's another reason why you could work with us. And last but not the least, we also have Viveo Cares Foundation, where we are accepting a lot of funds and donations to sponsor consultations for free to those people who don't have access to healthcare. So far, we have already completed 1,000 consultations, and the plan is to give another 9,000 consultations, not just for COVID, but also for people who have no access to healthcare. So those are the reasons that you should sort of consider us. I'm happy to take questions at this stage. Thanks a lot. I'm Gomti from Viveo.
Thank you so much also for your overview here. And continuing on talking about entering different markets, we do have a question again from our wonderful audience here. So what does it take for a doctor or a medical organization to join Viveo Health platform?
The platform is completely free to use. Anybody who is a registered doctor is free to sign up. When COVID hit sometime in May last year, we made the platform completely free to use. The idea was to ensure that medical supply is available to people who need it, even during the lockdowns. So right now, when we opened it up, we had doctors from 42 countries coming onto the platform. And today, in the markets where we are, we have thousands of doctors already registered and setting up their clinical digital practice with us.
That's great. One of our listeners as well brought it out once again, your goal, which is to provide digital health for 1 billion people. That is a very, very big number. And that's a big goal and might attract also some danger in terms of collapse of the platform, data leak, privacy issues, and of course also the question raises here, how are you protected against all that I just mentioned?
Yeah, I mean, that's a very, very pertinent question. And in the beginning, President had also talked about things like data security, privacy, and integrity. And we at Viveo take this really seriously. And we've made a lot of investment And we don't really believe there's like a minimum viable product in medicine or in healthcare. So we've done all the due diligence to make sure that the platform is fully compliant, like I said, and end-to-end encrypted. And so we are, that's the service and that's the quality and that's the assurance that we give our customers.
Now, speaking about especially individuals here, can individuals also access the portal as well when it comes to their own medical information?
Yes, absolutely. So individual customers can access the portal as well. They can schedule an appointment, and the doctor's calendar is actually into the platform. And it's open for individuals, it's open for companies, employees working in individuals. It's open to, so it is absolutely open to everyone.
Yes, that's great.
Yes.
We can continue, of course, this conversation now in a second panel. So my talented colleague Florian Marcus will take it over from here, and we'll continue with our speakers now in a second panel. So enjoy.
Meet 3 Estonian e-citizens, Lee, Martin, and their son, Hugo. While at school, Hugo accidentally broke his arm. The treatment he received can easily be seen by his mother through the patient portal. To enter the patient portal, Lee uses her digital identity, which is tied to her unique personal identification code. This is her doorway into the national health system, where healthcare providers gather medical data related to herself, her underage children, and her grandmother, Vive, who has given her authorization. This way, Lee has an overview of everything related to Hugo's treatment, including doctor's description of the X-ray, as well as the list of prescribed medications. Estonian healthcare providers and people with authorization are allowed to access the medical data, though the patient can always revoke this right. Every query made about the patient is logged, which makes the system reliable and traceable. Now that Lee is fully informed and at peace, she can start comforting Hugo.
Welcome back from Estonia's most comfortable seats right now. I've got with me the 3 speakers that had just given their short presentations to you. So thank you very much for being here with us. I have 2 questions for each of you that sort of connected to each other and that probably give the audience the best idea about how you work and what exactly you're looking for. So the 2 questions are, number 1, what's your ideal client? Number 2, how does the business model usually work for you? How would you like it to work for you? Maybe let's start with you, Liis.
Should I take both questions?
Yeah, just go for both. Take them all.
Thank you. Ideal customer. Our ideal customer actually is, for example, a large B2B event organizer. In UK, we currently are working with one 17,000 people event in July, for example, smaller ones even before that. So we like to, yes, work with big volumes in that sense. So we are also on the B2C market, where people who actually need to travel, where they need to visit another country, they need the certificate. So they acquire it through our service. Mm-hmm. But ideally, we work with B2B customers.
All right. And about the sort of company, the business setup,
yes.
How does that work?
Our business model is such that we ourselves are not a medical service provider. We call ourselves technology rails for medical service providers. So be it the lab or a clinic who basically outsources their testing service to us by thus expanding a lot their testing capabilities. And also the governments can expand their testing capabilities through our at-home certified, secure, trustable testing service.
All right. So you would be charging those end users
yes.
rather than the clients?
So we charge the end users through that model. Yes.
All right. Great. Gomti, what about Viveo? How does it work for you? Number 1, who's your ideal client if you could dream it all together? And how does the financing work?
For us, the ideal space would be anybody in insurance business, like I said earlier. So if today, the way the insurance business is, it's not going to be profitable because consumers are going the digital way. There's a McKinsey report which has said that 80% of the consumers are today trying to convert their consultation from physical to digital. So in that case, we come in handy, and to the insurance companies, we already have experience of working with them in Estonia and elsewhere in the Baltics. So there's a clear case where by using us, and they can be much more efficient, and that has a direct impact on their profitability, the claims ratio, as well as things like important metrics like customer churn is reduced, customer satisfaction scores improve because you have ready access to a doctor through this service.
Very well. About the business model, could you tell us more there?
I think the business model is fairly simple. I mean, it could be an a la carte model where it could be on a transaction basis, because the insurance companies don't mind spending on this because of the larger saving that they have over a period of time.
Yeah. Very well. Thank you so much. Ayn, tell us more about Guardtime's ideal customer and how do you make it all work?
Right. So we are ecosystem facilitators, which means that we enable different participants to engage in new types of relationships by making the data available between themselves. So it really doesn't matter from which part of this ecosystem. Currently, when we talk about Vaccine Guard, it usually is an organization who is responsible for a vaccination campaign. It can start from local municipality, or it can be a state or a country. It's very differently organized. Now we know that when the big concern is more or less over, that the first period where there was not enough vaccines, and now all those different organizations start to think, okay, COVID is not going to go away. There will be increasing number of adult vaccination campaigns that you need to organize. So I would say we start from the public authorities. However, on the other side, there are also, for instance, vaccine manufacturers who are interested in making certain that their vaccines are actually used through legitimate channels, and also if we can enable to collect anonymous kind of analytical feedback, so that, well, as you know, vaccines are quite expensive to produce. They have short shelf life, so that if you can pre-plan your manufacturing based on the need, that is also something where they are interested in working with us. And in the end of the day, the business model is a subscription, so that if you are making use of that infrastructure, well, on a monthly basis, if it adds value to you, then you are a happy customer.
And there are a lot of margins still being left on the table, absolutely. So
by all means, yes.
Absolutely. One question that we've been talking about before this lovely panel as well, that I would maybe want to discuss right here in front of the cameras also, is if COVID would magically disappear tomorrow, what would happen to your businesses? Are they adaptable for that kind of stuff, or what would happen? Again, from right to left, perhaps. You're right, yeah, yes.
Right. So I would be really happy if COVID would just disappear, first of all. What it would mean for my business is that, as I mentioned in the pitch, we are not focused only on COVID. We definitely want to be the rails for certified home testing, be it in clinical trials, be it in other tests that are already available today, but what needs still medical supervision, because there lacks the trust infrastructure to make sure that if you're supposed to do that test at home, how do we know that it's you, that the test is the test, that the person is the person, that you do the sample collection correctly, and so on? There have been a lot of interest from the anti-doping world. So and I assume that the business will be there for quite some time.
So you're going to be calling for the Tokyo Olympics as well.
That has been on the table, yes.
Okay.
That has been. Yeah.
So stay tuned, everybody.
Yeah.
Guardtime, what are your thoughts on this?
I think digital health is here to stay, Florian, I would say.
I hope so.
COVID actually accelerated it a lot, but I think it's here to stay. And the pointers are that, it's much beyond what's happening currently, because the platform enables you to sort of tackle very, very serious health issues like chronic healthcare, diseases that require lifelong management like diabetes, or like heart issues or women's health. And these, or dermatology, you don't need to really physically be in front of a doctor for all of these. And so the physical consultation can easily be on the digital platform, even post-COVID, and it's already trending that way for us. For us, it's not just COVID, it's already moved past that, for us. And also things like the convenience, the affordability, the saving of time, increasing of, the productivity, because now you can order everything like end-to-end on the platform. Your medicines can be ordered and delivered home. You don't need to step out to the pharmacy. Diagnostic tests can be had on the go, on the platform itself. People come, take up your samples, your results show up magically on the platform. So it's already happening, So I don't think that this is here to stay, and I think this is positive for us.
I would certainly agree with that. Ein.
Yeah. Well, first, before COVID, we based our work on three kind of assumptions. First is that healthcare is and will remain fragmented. And we can see that actually the disruption enables to make healthcare more resilient by keeping it fragmented, which means that certain things happen at home, then you have a mobile phone with you. So that the second assumption is that, okay, even if different things happen in different locations, in the end of the day, there needs to be a single version of truth. Mm-hmm. So you need to bring together data from various sources, and then, be it certificate for travel or just your medical record in another location. And then the third part is that, okay, you still need to make all that privacy preserving and secure. So that those three assumptions haven't changed. So we are actually, through this Vaccine Guard, providing real-world data capabilities to maintain, this specific area, which is vaccination campaigns. But similarly, clinical trials need, from the testing up to the point that you file your records to regulator, there are a lot of activities that need to tie together so that in the end of the day, whatever inference you make is reliable and trustworthy. So that, yes, I personally hope that this madness is over at some point of a time. I can, travel freely and not try to think that what kind of tests I need to make. I'm good, certificate is there, so that at least it has been made less inconvenient. But in the end of the day, probably other tests are much more pleasant to think of.
I would certainly hope so, yes. I very much encourage the audience to also take part in this, and please submit your own questions. In the meantime, I wanted to ask, especially this panel, one of the questions that I also asked the first panel. We have to bear in mind that we have a double-balanced panel here. Not only do we have a lovely gender balance, but we also have 2 Estonians living in Estonia and 2 immigrants, myself and Guardtime, living in Estonia as well. So I think we have a lot of different perspectives here. If we think about one sort of part of the Estonian e-health system that we would want for the entire world, including the US and the Americas in general, what would that be? Ein, maybe you want to start.
Well, I'll start by saying it's possible. When I was the Undersecretary for e-Services and Innovation representing Estonia in Europe, that was the time right after the GDPR was passed. And then I said that, GDPR is not an obstacle, because Estonia has been living through flourishing digital services in healthcare and all other domains while following the same principles. Mm-hmm. So that I do think that the culture that you can protect privacy, but at the same time enable services that are actually cool, that people like, and that enable innovation. If people can kind of take this spirit with them, and then all this would be possible in other parts of the world, the easier it would be for us to make business, because there are many like-minded people.
Yeah.
I would actually add to that, or play on the similar tune that we've been very active in UK now, and you see that the very often, even in the middle of the pandemic, where you would think that, if people need solutions, they act fast, they think fast, they decide fast. And when you see that it doesn't happen, then it's like extremely frustrating. Mm-hmm. So yes, don't want to talk about specific like governments, non-governments, businesses. Don't want to kind of go into this binary world, but still, it's. I would say that Estonia still has this lovely mindset, which I think Ain mentioned also, that we are still able to do quite fast decisions and bring solutions to life pretty fast. And it always starts by asking, I think, like, why not? Why should we not do this? And there's always obstacles. There's always hard things to solve. There's always issues, policy changes, whatnot. But if you always start by stating or reading the law of like, this can't be done, this can't be done, and this can't be done, so done, right? Easy. Problem solved.
It's the pragmatism.
We don't need to deal with it. Yeah. Then it's really hard.
That's very fair.
And it makes life for businesses extremely hard, who actually want to help and want to create new powerful solutions.
I think it's fair to say that everybody here on the stage is happy to help society as a whole, humanity as a whole. And I think this Estonian pragmatism that you sort of pointed to is still quite prevalent in this country. Yeah.
I hope.
Gomti, your impressions?
For me, I mean, it works like magic because, I mean, I could point out so many things from electronic health records or the way your taxpayers' money, you're actually getting the full worth for it, because this is something that, we don't see back home, at least in many Asian markets and rest of the developing markets. But, what strikes me and what's good for us is that it's not perfect, We see that, just like she said, I mean, there is this wait period, for example, for a specialist doctor. And say you've been diagnosed with, say, for example, something like cancer, and you have to wait for chemotherapy for months. There's that time, and that's where Viveo Health comes in. We make sure that you have access to specialists really fast, because we have a good network of on-ground partner clinics, and so then your accessibility can become better. So it's not perfect, but it's much to admire and learn from, I think, for the rest of the world.
Yeah, absolutely. For me as a German, what was mind-boggling was the privacy aspect of things, and I think this also pertains to all of the things that you're doing. It's not just that the data is available to whomever we choose to make it available, but also that we can block it for those that we don't want to see the data. And I think this, while it was discussed that privacy is not such a major issue for the American market, it's still something to be taken into consideration. If we're looking at the amount of lawsuits that are being filed in the US, I can see several lawsuits already arise if digital data is somehow illegally obtained or copied or changed or anything like that. So this for me is quite impressive.
We work quite a bit with cybersecurity in our company also from the day one, and we do get the questions like, it's interesting, a young startup and already dealing with cybersecurity, and then we're like, huh? We're in health, like we can't get it wrong, right?
How can you think without cybersecurity?
Yeah, exactly. So it's hygiene and should be like designed from day one into the systems, but if you think only of that, then yes, a lot of obstacles may appear.
When you've had conversations with medical specialists, whether it's doctors or caretakers, with the patients as well, of course, have you had the impression that the openness to digital solutions and the digital literacy is similar across the different markets that you're looking at? And could this be an issue for the US as well? Or do we feel like that's a sort of humanity-wide question that we all approach reasonably similarly?
I think for us, at least, it's like healthcare for various like demographics. It's slightly different. Like the older demographic might not be so technologically savvy to download an app, for example. And we realized this when we were creating the solution, and so we made it really simple. So there is also a way by which it's browser-based, so you can just send a link. And it can be on a WhatsApp chat, or like it could be a message sent, and you just click it and you're connected to the doctor, voila. So even that's available. So one needs to think about the various age groups. Of course, people like us and the younger lot don't have such an issue, but I mean, I don't know about the other guys.
Yeah, I also think that this variation doesn't really go necessarily by countries. It is probably more by demographics, luckily, I read that especially elderly people have been the group across the world who have discovered the benefits of digital services during this COVID time, because they were the ones who were most vulnerable. They were the ones who were afraid of. Now they realize you can talk to your children, you can talk to a doctor, you can have tests done, you can do many things. So
it's magical.
This is certainly something that will remain after this.
Unfortunately, COVID has forced them actually into this, right? But at the same time, it benefits them because now they have needed to learn the.
Well, you need certain incentive, and once again. I hope we have passed that phase, which was not that long time ago, when people came to Estonia, and the first question around security was that, is it safe? And I think now, when they start talking and finding what would be interesting, is the question has changed, how can it be done safely? So that I think this has really changed, and in most of the countries in the world, I haven't been to all the countries, but based on the discussions that we've had around 70 countries during this vaccine guard discussions, this if has been replaced with how, and I'm happy about it.
And the other thing is the rural markets, for example, like the data connectivity or the bandwidth, right? So which is why we have solutions like chat, which are less bandwidth consuming, not just like a video service, also multiple languages. That's been key, because not everyone speaks English, not everyone's got native languages. So I think being multilingual and local is key.
And we're not just talking about questions like data literacy, but also about literacy itself. When we think about some of the African countries, for example, literacy might be a question, but also mobile-first developments are very clearly a game changer for those countries. Whereas I think in the EU and probably also in the US market, it's a bit more stationary, if that's fair to say. Fine.
But actually, the digital tools are exactly the ones, if done and designed in the right manner, which can overcome this literacy problem. I think we all have seen, 2-3-year-old kids who can already interact with the screen, and also it has been demonstrated and proven that elderly people, if there is no mouse, but actually just a touch screen, it does not require many skills in order to start communicating. So that here the digital is really empowering.
Yeah, to create a more tangible world that makes it feel less like a service and more like a solution. I think that's what you're also all three trying to do. You wanted to add something at the end, or? No, all happy. Well, the German inside of me is celebrating because we are finishing this panel on time. And I would like to hand over to my lovely colleague, Annette Numa, to send you all on your way. Thank you very much for watching and contributing to this panel as well.
I would sincerely like to thank absolutely everyone who has joined us today and spent this last 2 hours. It was very interesting for me to listen to all this presentation, and I really do hope so that also for all of our listeners and our audience today. This recording also of this webinar is going to be available just in a couple of days so that you can watch it again. And if you couldn't join from the beginning, then you can rewatch this again. So we'll upload this information to our homepage. So if you don't follow us yet, then you can already do that as well. Just for the information that the e-Estonia Briefing Center with the digital discussions is going on a summer break. But good news that we will be back in September with a new discussion already. So I wish you a very, very pleasant day, evening, wherever you are in the world right now, and try to stay healthy and until the next discussions. Thank you.